impact on child's ability to grow, learn, and rise out of poverty. Reckitt Benckiser is committed to a world where people live healthier lives. RB, along with its partners, started a nutrition program in the two worst affected districts of Maharashtra, Nandurbar and Amravati.
Hello and welcome to our special show. NDTV and Dettol present Banega Swasth India. Now there is a cost to healthcare, but you pay a huge cost if you choose to ignore this original cost. But what if we were to tell you that investment in healthcare can actually help you earn, help the country's economy thrive? You don't just save money, but earn more and contribute to your economy. Now this isn't a drawing room observation, but the finding of a comprehensive new study on the economic advantages of investing in your health. Let's put a number in here. Imagine if a rupee spent on nutrition and healthcare returned 37 rupees. 1 rupee invested, 37 rupees earned. Money grows 37 times. Even the best investment scheme in the world cannot offer a deal as lucrative as this. Investment in health is not just restricted to medication and hygiene, but something as basic as nutrition. A healthy body will ward off diseases, thus reducing the burden on our healthcare systems. So we need to do this now more than ever before in the times when we've been struck by a pandemic. COVID-19 is not an India-only challenge, but the challenges it will pose for India will be unique and glaring. How do we protect our marginalized population, the migrants, rural population, the children, feeding mothers? The struggle with attaining our nutrition targets will be bigger than ever. Now is the time to pay attention towards something as basic as a healthy and balanced diet. It is an important factor to maintain immunity to fight COVID-19. If not done now, an unending cycle of undernutrition and infection could be triggered with lethal consequences. The first step to solving a problem is to understand it fully. Let me explain. Here is an overview of India's nutrition problem and why we need to emphasize on women and children. So we have sourced this information from UNICEF. Undernutrition is a major cause of disease and death. It affects women and children in impoverished communities. Malnutrition remains a silent emergency in India, even now. Despite a fast-growing economy and national nutrition mission, India records the worst levels of child malnutrition in the world.
The importance of malnutrition cannot be overemphasized. The global burden of disease analyses showed that malnutrition still is a major risk factor for death and disability in India across all age groups, particularly for children under 5 years. And I think we have to understand malnutrition in its entirety.
To understand the measures that need to be taken, we need to understand the issue better. And let's first start with the definition. What is malnutrition? Now we have sourced the definition from the World Health Organization, and it says deficiencies, excesses or imbalances in a person's intake of energy and or nutrients. Now malnutrition can be divided in two broad categories, and you'll be surprised to know the categories. Category number 1, undernutrition. Now what forms undernutrition? There's stunting, which means low height for age. There's wasting, which means low weight for height. Then there's a problem of being underweight, which explains itself, low weight for age. micronutrient deficiencies, that is lack of important minerals and vitamins. And then the second key aspect, overweight. Who would have thought? This too is malnutrition. Obesity, food which lacks complete nutrition. You get the feeling that you're eating a lot, but you're not eating a healthy diet. Diet-related non-communicable diseases are a big risk. These include stroke, heart diseases, diabetes, and cancer.
See, malnutrition has many dimensions. The commonest is where people eat less than what is required to remain healthy. That's what we call undernutrition. And the other extreme is where you need more than what you need. That is overnutrition leading to overweight, obesity. And what straddles both this form of malnutrition is deficiencies in vitamins and minerals, what we call as micronutrient deficiencies. And so there are multiple dimensions to malnutrition.
NDTV and Dettol have partnered for 6 years now to stress on the need for hygiene and cleanliness. Last year, we made the switch from Swachh or clean to Swasth or healthy. And one of the main points of the campaign has been on improving maternal and child nutrition, which expands the scope to reach his or her full potential, making the first 1,000 days of the child very crucial. The stress here is on nutrition. Again, the solution to the problem is in understanding the definition. What is nutrition? Good nutrition is not about the quantity of food, but the quality of the food consumed. This should be a priority area for all. Good nutrition comes in various forms. In adults, through a healthy diet, through supplements, and then in newborn babies, through breastfeeding. Now we come to identifying who is most vulnerable, who is malnourished. Is our assumption correct that malnourishment is only something that affects little children? Well, no. While studying on malnourishment and in an effort to track the vulnerable, we decoded the dual Indian problem. Various reports suggest that 23% women and 20% men are undernourished in India. And 21% women and 19% men are obese in India. Do you know what that means? 44% women and 39% men in India may not be adequately nourished. Do you know what this means? Over 40% of India's population faces the nutrition challenge. Let us now come to children. Child malnutrition is a silent national emergency. It accounts for 68% of all infant mortality in India. We're not saying that no progress has been made. Progress has been made, but we have miles to go. Because India is likely to miss the National Nutrition Mission targets for 2022 and also likely to miss the WHO and UNICEF targets for 2030. Some of these figures are startling. Currently, 1 in 40 babies die during childbirth and 1 in 25 children before the age of 5. Most of these deaths are due to lack of access to clean water, pneumonia, diarrhea, and malaria. These diseases represent lack of sanitation and hygiene. Malnutrition contributes significantly to the high mortality and morbidity by reducing the immunity and thereby increased infection. On the other hand, lack of sanitation causes gastrointestinal disorders like diarrhea, which is a leading cause of death among children. If nutrition and hygiene can begin in every household, a strong foundation for future health of society can be laid.
Water, good sanitation, hygiene, and proper waste management is a potent weapon to fight malnutrition, pandemic infection, and prevent deaths. It is necessary to achieve India's Poshan Abhijan goals, Jal Jeevan Mission agenda, and also it can make a pandemic infection-free and malnutrition-free India. We need people's movement. We need Jan Andolan. And the message has to reach at households, individuals, and specifically women and children who are the hardest hit, and also in marketplaces and everywhere. Let us pledge today to achieve this goal.
And to lay that foundation stone, one has to start early. Which is why we come to the very crucial first 1,000 days. Why are these first 1,000 days so important for a baby? How can it help? Let's find out. And first of all, how is this calculated and what is the rationale behind it? Let's quickly tell you that. So here is a way we are trying to compute what constitutes the first 1,000 days. 270 days of pregnancy, 365 days, which is the year 1 of the child after birth, and also add 365 days, which is year 2 of the child after birth. Add this all up, you have 1,000 days.
If you look at a 2-year-old child, the height of a 2-year-old child is already half that of an adult. So in the first 2 years, the child is growing to half its adult height. Similarly, most of the brain development occurs in the first 2 years of life, and after that there's really very little scope for further growth of the brain. And so the period of pregnancy and the first 2 years after life are so important, both in terms of having the right nutrition for the growing baby, but also in terms of the cognitive and intellectual and social stimulation that the child gets from the environment in which he or she is growing up, in order to foster optimal brain growth.
It's a comprehensive deal. During the 270 days of the pregnancy, a would-be mother has to be taken care of. The next year is about effective breastfeeding, which will give a newborn baby the key nutrition it needs, something which no other supplement or substitute can effectively provide. 365 days are a mix of food rich in nutrients which will shape the child's growth, brain development, and build the child's immunity. Okay, so how do we ensure this? A huge part of the burden falls on us, the immediate family. But having a strong, robust healthcare system down to our villages can really help win this game. One such role is played by the community nutrition workers, also known as the CNWs. They play an extremely critical role. They take messages and teachings to doorsteps of women. This is most effective in rural parts of India. Anganwadis play a critical role. Their job is to educate women about sanitation and hygiene. Project Hygiene is actually a very, very potent weapon to crush malnutrition. It is not like we do not have policies or that we are not doing a bad job. In fact, we are doing a very good job. But the time has now come to accelerate the process of growth by setting targets.
The country has made several attempts over a period of time to focus on nutrition of women and nutrition of children in particular. Our ICDS program, which started way back in mid-70s, was the program to address this area for a long period of time. And over decades, there has been decline in undernutrition in children. It has happened. It is largely a secular decline. But what Poshan Abhiyan, the National Nutrition Mission, aims to do is to bring in massive acceleration in decline of undernutrition in children, and also to address anemia, both in children as well as in women. So it's a very, very concerted effort. It's a very complete effort, because in this we have the package of interventions which are complete as we know today in terms of science. It brings together food intervention, breastfeeding intervention, but equally importantly, the interventions in the health sector, which are so very important. We can talk more about it.
So let's take a look at the government's action plan. What has the government done so far in fighting malnutrition? So you've got the Integrated Child Development Services, known as ICDS, the National Health Mission called the NHM, the Janani Suraksha Yojana, the Matritva Sahyog Yojana, the Midday Meal Scheme, and the National Food Security Mission. Have we made significant progress? Yes, absolutely. Is it enough? No.
We have made progress. We have made significant progress in reducing malnutrition. Not only that we have made progress, every region of the country has made progress. But the problem is that the progress that we are making is not enough. The rate at which we are making the progress is what is bothersome. With the economic status that India has today and the available resources in terms of nutrition interventions and the infrastructure we have created, we should be making a far more rapid decline in malnutrition. That is unfortunately not happening. And also, the progress that we are making is much slower than some of the countries in our neighborhood who have very similar socioeconomic indicators. That is what is bothersome. It's not to say that we are not making progress.
Every little effort counts, from government to individual to institution. And here, we can't help but talk about RB's Nutrition India program. So what is this program and what is the objective? Let's find out. So this program aims at taking forward the efforts of the government to start with. RB and Maharashtra government have implemented 2 successful models. These projects have been implemented in 2 of the worst affected districts, Nandurbar and Amravati. The project aims to end malnutrition in these 2 districts. And in 1 year alone, 6,500 under 5 children have been saved.
मेलघाट रीजन है जहाँ पे कनेक्टिविटी काफ़ी कम है और महाराष्ट्र में नंदुरबार और अमरावती एक ऐसा रीजन है जहाँ पे कुपोषण का प्रमाण ज़्यादा है। तो एज अ ट्राइबल रीजन में हम लोग काम करते हैं जो कि मालन्यूट्रिशन एड्रेस करने के लिए मेन समस्या ये आती है कि प्रेग्नेंट मदर्स रहती है, उनका प्रेगनेंसी का डेट आ जाता है, उनको भर्ती करने के लिए या फिर सैम मैम की जो बच्चे रहते हैं उनको एनआरसी में ले जाने के लिए हमको एम्बुलेंस की ज़रूरत होती है। नेटवर्क ना रहने के कारण हम एम्बुलेंस को नहीं बुला पाते। तो एक मेजर चैलेंज है कि हम लोग थ्रू नेटवर्क कनेक्टिविटी हॉस्पिटल में नहीं पहुंच सकते हैं। जैसे कि मेलघाट में चिखलदरा जो है काफ़ी रोड, अगर उसकी सिचुएशन देखा जाए तो कई रोड ऐसे हैं जहाँ तक लोग पहुँच नहीं सकते हैं। बस फैसिलिटीज़ भी काफ़ी बारिश होने की वजह से कम हो जाती है। तो एक मेजर चैलेंज है कि रोड काफ़ी बराबर नहीं है।
मेरे गांव से सर मेरे बाकी जो विलेज है सारे पास ही में है, लेकिन वहाँ पे जाने के लिए कुछ भी ऑटो नहीं है, बाइक भी नहीं जाती है। रोड का रास्ता बहुत ही काफ़ी ख़राब है, उसकी वजह से मुझे पैदल ही जाना पड़ता है। 2 से 3 किलोमीटर दूर तक के मैं पैदल जाती हूँ। तो वहाँ जाके पहले तो आंगनवाड़ी में विज़िट करती हूँ, फिर उसके बाद में उनसे पूछती हूँ जो सैम मैम में आ रहा है उनके घर पे जाके विज़िट देती हूँ। फिर उनको बताती हूँ मैं साफ़ सफाई के बारे में, क्योंकि लोगों के घरों में काफ़ी घरों में देखा जाए तो एकदम हाइजीन मेंटेन नहीं करते हो वो। तो फिर उनको सैनिटेशन के बारे में बताती हूँ कि साफ़ सफाई कैसे रखनी चाहिए।
ये जो एरिया है मेलघाट, ये आदिवासी भाग है। आदिवासी भाग में ज़्यादा पढ़े लिखे लोग नहीं हैं। अभी भी जो ये 10 साल 15 साल की जो पीढ़ी है ये शिक्षित है। किस उम्र में शादी करना है, किस उम्र में बच्चे करना है, इसके बारे में ज़्यादा से ज़्यादा ये लोग अज्ञान है। इधर के गरीब परिस्थिति के लोग हैं, किसी को घर नहीं है, किसी को कैसे भी रहते झोपड़े में। तो ऐसे इसमें अगर प्रेग्नेंट बाई वहाँ है, समझो कि वहाँ एक आधी डिलीवरी हो गई, पर्दे लगे हैं, घर को ऐसा मुझे ये सपोर्ट नहीं है और बच्चे को वो नीचे ही डाल रही। तो हम 4-5 बार गए, उसको बोला कि ऐसा नहीं डालना भाई, एक तो झूला बना, झूले में उसको हमने झूला बनाया, बच्चों को वही डालने को बोला, फीडिंग किया, उसको ऐसा लेने को बोला, फिर आधे घंटे के बाद उसको झूले में डालने को बोला। तो उसका वजन था 2 किलो पहले। जब हमने ऐसा करने को बोला उसको, तो उसका वजन आज 2 किलो 700 ऐसा हो गया 2 महीने में। नहीं तो 2 किलो के अंदर था वो बच्चा, और माँ दूध भी नहीं पिलाती थी बरोबर। तो हमारी आशा भाई, हमारी आंगनवाड़ी सेविका, मैं और ये लड़कियाँ, कौन है, राखी, ये भी बार बार उसके यहाँ गई और बताया, तो अब वो बच्चा अच्छा है।
जब डिलीवरी हुआ तो जब से 1 किलो का था, तो 1 किलो में तो ये सुशीला नायरा में डिलीवरी हुआ। जब से अमरावती गए 1 महीना रहा, वहाँ से थोड़ा दूध पीने लग गया। फिर मैडम उनमें देखने आते थे, राखी मैडम, फिर ये दूध पीते थे। फिर खाना वो आलू को वो भून के इसको देते थे, फिर पराठे का रोटी बनाते फिर वो देते थे। हाँ, अभी ठीक है।
This is indeed one of the very interesting projects which RB has been doing in the space of the first 1,000 days of kids' life, which is very, very important. As we see the global indicators of hunger, malnutrition, the same problem also exists here also in India. And we took the regions in Maharashtra, we chose the geographies which actually need the intervention at the last mile. And the intervention happened so nicely, like, we have 40 last mile, health workers who are all girls from the local communities. They are being trained in addressing the issues of first 1,000 days, which doesn't just, talk about nutrition per se. It talks about hygiene, it talks about sanitation, it talks about nutrition, it talks about breastfeeding a lot. And on the top of that, you have the ASHA workers, which are the frontline workers. The workers which are under this program has also played very significant role for the timely referral of the cases of the kids who are severely malnourished kids and moderately malnourished kids.
Given our country's population, this program is a small yet an extremely significant first step towards ending malnutrition. Now let's also quickly tell you what the social investment vision entails. So it's a 5-year project that aims to cover 1,000 villages using digital and artificial intelligence-based innovative training modules. The aim is to strengthen the health, hygiene, and nutrition status of pregnant women. Also, reduction in the number of children under 5 who are stunted. It aims to reduce and maintain childhood wasting to less than 5%. The project has worked with local communities to build up a workforce of traveling CNWs, or community nutrition workers we just told you about. CNWs are rigorously trained by a team of public health experts, pediatricians, gynecologists, and community development specialists. Going from village to village, these community workers deliver simple and effective messaging around nutrition and hygiene to create behavioral nudges using specially designed games, nutrition kits, multimedia stimuli, and community festivals. Higher risk groups are identified with the interventions of community workers. Regular follow-ups are done. Now this is done through audio-visual medium, where the community is educated, and wherever required, cases are referred to better health facilities. Here's the model that they follow. Care for mothers during the 270 days of pregnancy, immunization, sanitation, and adequate diets to be maintained, post-birth mother and child taken care of for the next 2 years, therapeutic food and management of lactating challenges. But none of this can be made possible without the hard work of these few unsung heroes we've been talking about.
मेरा जो न्यूट्रिशन वाला किट है बैग, ये जब मैं माता मीटिंग लेती हूँ तब मैं उसमें 5 गेम है
जो न्यूट्रिशन के बारे में है, तो वो मैं यानी मदरों को खिलाती हूँ और खेल खेल के तौर पे उनको मैं बताती हूँ कि अपने जो न्यूट्रिशन कितना ज़रूरी है अपने लिए, अपने स्वास्थ्य के लिए, अपने हेल्थ के लिए। उसके बाद में मैं गांव में विजिट करती हूँ, जो मेरे श्याम मैम के बच्चे रहते हैं, जो मेरी प्रेग्नेंट वुमन रहती है, जो स्तनदा माता रहती है, जिनको तकलीफ़ है, उनके घर जाती हूँ मैं, उनसे मिलती हूँ, उनका हालचाल पूछती हूँ, उनको देखती हूँ, फिर उनको बताती हूँ मैं कि आपका बच्चा जब कमज़ोर है तो आप उसका अच्छे से ध्यान रखो, उसको अच्छे से खिलाओ, खाना अच्छे से खिलाओ, दिन में 5-6 बार खिलाओ। इस बारे में उनको मैं बताती हूँ। साथ में एक हमारे को जो हमारे न्यूट्रिशन की तरफ से हमको वीडियो बना के दिए हुए हैं, तो हम वो वीडियोस के तौर पे वीडियो के थ्रू उनको दिखाते हैं, तो वो देखते हैं और वो सीखते हैं और बार बार यानी उनको जब हम वीडियो दिखाते हैं हमारे टैब में तो वो जल्दी सीख जाते हैं।
मुलाच्या जीवनात खूप महत्त्व असते। हा वेळ सुरुवातीच्या 1000 दिवसांच्या कालावधीमध्येही येतो।
पहला यानी कि कुपोषण में था, बहुत बच्चे का तबीयत एकदम खराब रहता था। जब से CNW मैडम, राखी मैडम आई तब से उसने हमको अनुभव बताया, अच्छे से समझाया कि हाथ धोकर खाना खिला, रोज दिन में मतलब 4-5 बार खिलाने का लगाया और हम उसने बताया, वीडियो बताया, वैसा वैसा हम उस बच्चे का मतलब ख्याल रखता। जब से थोड़ा मैम में आ गया मेरा बेटा, थोड़ा अच्छा हो गया।
Child malnutrition is something which is requires both the system as well as the family and the community to be aware of. So I think the most important step that the project, the Nutrition India program, has taken is to create community nutrition workers, and these community nutrition workers, they have been trained and equipped, and they make home visits along with Anganwadi workers, ANMs, and other such frontline health workers of the government to see how awareness around nutrition, awareness on how to prevent malnutrition in children, in mothers, can be done.
The community nutrition workers, CNWs, they're an extremely critical part of the Nutrition India program. An informal community nutrition cadre comprising of women from local regions, trained and deployed across Nandurbar and Amravati. This cadre is essential to mediate between the community and healthcare providers in order to promote positive healthcare behaviors and to facilitate sustainable adoption of health practices. 41 young women have been trained so far. The tireless efforts of these CNWs have led to an increased trust of the community on the modern healthcare system. Let us now look at what all is done. So you've got the nutrition kit. This kit is targeted towards increasing knowledge and building awareness. A healthy nutrition practice is established and health-seeking behaviors among expectant mothers. The kit aims at imparting message of habits, good and bad eating habits during the first 1000 days of life is the primary message. Education on nutritional values of food items is also stressed upon, and hygiene practices and slides demonstrating best practices during pre and postnatal stages forms the crux of this activity. Next, breastfeeding pods. These pods are also called the Hirkane Kaksh. They're being installed everywhere. They ensure comfortable and private space for breastfeeding. Its promotion and sensitization effort continues to spread this message of breastfeeding in public spaces. The social awareness about breastfeeding and its benefits is specified by the community workers.
This program has been able to do two other things also which are very critical. One is, like, as you know, most of the places lack the space for the breastfeeding. So there are breastfeeding pods which were actually made so that there are safe space for women who go to the farms, who are there in the hinterlands, who are there in the cities. So these women can actually go to the place which is a hygienic place where actually moms can actually feed the babies, and resulting into the promotion of breastfeeding actually.
The impact of RB's initiative is a small step towards a wonderful future, showing great results.
More than 6,500 severe acute malnourished children were identified with the district teams in both the districts, Amravati and Nandurbar. So they have been supported, and they are now out of their malnutrition status. More than 1,000 district level officials responsible for supporting nutrition outcomes in the districts. They have been trained on new ways and on how to address child malnutrition, maternal malnutrition in these districts, and they are doing the work of it.
It's a small step today, but it's giving great hope for the future. 32,900 under 5 children were reached by this intervention. 4,161 under 5 children were provided treatment under the program. 3,900 mothers out of a total of 4,192 were provided support through multiple interventions. Out of 861 pregnant women due in 2020, 800 were provisioned with an institutional delivery. 1,268 homes were supported through kitchen gardens to assure an adequate diet.
This project is just not a nutrition project, as it has impacted on the lifestyle of the communities it has worked upon. It has been such a success story that I feel that it's going to be a pathfinder for many of the future projects who are going to improve the nutrition and lifestyle of communities. There are several innovative new things that this project has taken up, very successfully implemented, but I will just mention two very important points. The first one is that this nutrition thought of taking into all the factors which support improvement of nutrition. An integrated policy was developed and, most importantly, implemented. It is rarely done by any project. This project looked into supportive factors like water, sanitation, lifestyle, gender issues, mother's health, everything together, and very successfully, in a very coordinated manner, implemented it. And I think that's a great success for any project. The second important point is that it built on the local strength, local cultures, local communities' beliefs, and nothing was imported.
So what's the way forward? In the immediate future, COVID-19 has brought with it a whole new set of challenges. Anganwadi centers are not functional, door-to-door interventions too got affected due to the lockdown. There's also an impact on healthcare services. For instance, pregnant women seem apprehensive in visiting hospitals for regular checkups or even delivery.
Our frontline workers make door-to-door visits, sit with mothers, sit with community elders, with groups and talk about nutrition, talk about, share information about how children can be supported, mothers can be supported to come out of their current malnutrition status. Now that process definitely gets affected because of social distancing, because of the challenge to mobility of our frontline nutrition workers, as well as the government frontline workers, the ANMs, ASHAs, and Anganwadi workers.
Our fragile food systems have also been affected. Containing the virus has caused food and nutrition shortages and driven governments to reduce social services, such as school nutrition programs that the most marginalized relied upon. As we fix a broken supply chain, we must know that food or dietary supplements cannot prevent or cure COVID-19. But a healthy diet leads to a better immune system, which can increase the chances of fast recovery and reduce the load on hospitals. Now is the time to make the investment in healthcare. We need it most now. And I want to end from where we began. Are these Nutrition India programs return on social investment formula? Each rupee invested in healthcare will generate 37 rupees worth of returns. Let's extrapolate these figures for you to understand better. 1 rupee invested, 37 rupees earned. So if 1,000 crore rupees are invested, 37,000 crore rupees will be the return. Let's add a zero in here. 10,000 crore rupees invested will lead to a return of a whopping 3.7 lakh crore rupees. One more zero. 1 lakh crore rupees invested in healthcare will lead to a return of 37 lakh crore rupees. It makes so much sense, doesn't it?